So yes, we have years of experience now with COVID-19 vaccines and the flu shot. There's no interactions between the two. And it's a great way to make sure that you're protected for the respiratory season. So you can absolutely get the same shots at the same time, and a really good idea that you get both instead of one during the respiratory season. That's a great question. There is a lot of influenza activity starting. We're seeing it in the Northern Hemisphere. And so folks should consider getting their influenza vaccine now, as we're gonna see numbers rise. So important, it's not the time to put it off or time it perfectly. It's the time to go get it now so that you have protection during the respiratory season. It's a good question. So we make sure influenza vaccines are matched based on the strains we think are going to show up. Depending on things year to year, they may be 30 to 70% effective in preventing influenza. We know the effects are better at a community level, so more people getting the vaccine means more protection in the community. And for folks who get the vaccine, the risk of ending up in hospital is markedly reduced with getting one of these vaccinations. So for the most part, they are benign. People will get a sore arm. There may be people that feel a little bit tired or fatigued the day or two afterwards. Most of these resolve very well. It's important that people understand if they're allergic to prior vaccines, such as some of the components, that they discuss that with their provider. But for the most part, these vaccines are relatively safe and have minimal side effects. So the influenza vaccine, the one that's injectable, is not a live vaccine, meaning it has no components that can actually cause the infection. So people can be reassured that their risk of getting influenza is going to be decreased from getting the vaccine. The vaccine can't cause influenza. It simply modifies and gives your body a chance to fight the infection when you're exposed to it in the community.